Next speaker is Amin Madani, and Amin Madani comes from McGill University. He's a fellow there, and he has been instrumental to help us advance our educational ability with FUSE. He's going to give you sort of an overview of what FUSE is. Amin, thank you very much.
Thank you. Good afternoon. Thank you to the committee for giving me the chance to talk today. And thank you for everybody for coming here today to learn about FUSE. It is the fundamental use of surgical energy. This is a SAGES initiative. It's a curriculum to teach you about surgical energy-based devices, stuff that we use every single day in the operating room. It is surprising to me that up until now, there is no curriculum, a formal curriculum to teach us about energy-based devices. And for this reason, SAGES has made FUSE one of its top priorities. So my goal for the next 10 to 15 minutes is to convince each and every single one of you that this is a program that's very worth your while, and not only to get you to do the curriculum, but also to convince your colleagues to participate as well. So it's a SAGES initiative funded through SAGES as well as through industry. We've put in a lot of effort to keep this as generic as possible. So it's not to really teach you about specific devices, but more so to teach you about general principles and concepts that apply across various energy-based devices. The content of this program was developed by the FUSE committee, which I am a part of, and the content of these slides were also developed by that same committee with their consent. And a lot of the pioneers of this initiative who have spearheaded this initiative are here today, and we are indebted to them. So why are we here? This is the first question I ask myself. Why do we need a curriculum to teach us about energy-based devices? They've worked for so many years. Why now? And we're just going to do a little bit of audience participation. I want you to put your hands up if you consider yourself to be an energy expert. So put your hands up if you're an expert of the device you use every single day. So a little modest here. Sometimes we have an engineer or two in the crowd who really know their devices, but most of us are not experts. Just 5 hands apparently. Put your hand up if you can assemble your own favorite device without any help from the nursing staff. So the ligature, harmonic, whatever circuit it is, can you assemble that by yourself? Put your hand up. So we have a few here. Most of us can't. Have you ever had an injury from an energy device? So you're buzzing on your thumb, you're buzzing, and oh, I got a burn on my thumb. Who's had that happen to them? So yes, a lot of us have. Who has taken care of a patient who's had an iatrogenic injury from a thermal or energy device? And lastly, have you ever used an energy device without any prior training or without even reading the package insert before using it? So here's a new device we use today. I've never used it before, but how do you turn it on? Okay, let's just use it on this patient for the first time. Sound familiar? We really need to own this stuff. It's stuff we use every day. We need to know how it works. We need to know what their pitfalls are. We need to know how to troubleshoot them. We need to become experts because problems do occur. So energy devices are very useful. We use them for hemostasis, dissection, ablation. They form part of our daily armamentarium to deal with any problem in the operating room. But there's a flip side to this. Number one, they can lead to very severe and significant complications. Things like OR fires, patient burns, interference with other devices like pacemakers. And the second thing is they tend to be very poorly understood by the operator, i.e. surgeons. It is estimated that about 600 operating room fires happen in the United States alone annually, a subset of which end up with very severe disfiguring injuries and even some mortality as well. But not just OR fires. Patient burns from electrosurgical injuries happen a lot more often than we think. But not just for the patient, but also the impact on the healthcare system. Hundreds of millions of dollars are spent annually on medical legal claims related to electrosurgical injuries. So it is a significant public health issue. And the public is becoming more and more aware of this issue. You will see a lot of these in the lay press. This is from the NBC Today show. This patient had a head and neck procedure done and sustained a very severe facial burn. Another one I found recently of a patient with cardiac surgery and had an OR fire. Can it happen to you? Can it happen to your institution? The answer is yes, it can. This unfortunate child sustained a very bad injury just had a tonsillectomy done and had a very bad burn related to the dispersive electrode or the grounding pad. This injury is 100% preventable, and it is our responsibility to take the initiative to educate ourselves to make sure that never happens again. This is a case that I was involved with, a patient who had an elective prostatectomy done, otherwise completely uncomplicated case. We were consulted later, the patient had diffuse peritonitis, intra-abdominal sepsis, and when we did the laparotomy, we saw this cecal perforation. Several laparotomies and open abdomens later, skin grafts, this is what the patient looks like, discharged 5 months later. So electrosurgical injuries from laparoscopy are estimated at 1 to 2 in every 1,000. This may not seem like a lot, but when you consider that 2 million laparoscopic cases are done every year, you begin to see the impact. And these numbers are from several years ago, so there are more and more of these cases being done. Not just with electrosurgery, but also we just saw the ultrasonic devices. This is from a gynecologic procedure done with an ultrasonic dissector whose Achilles heel, as we heard, is that the tip tends to get very, very hot. So with the proper training and education, one would know to avoid going near viscera or to use it as a retractor. This patient had a pelvic perforation, sepsis, ended up having a laparotomy, ostomy, pelvic washout, and a lot more morbidity than they signed up for. So enough that there's a lot of complications. We tend to not have a poor understanding of them at the same time. This is a pilot exam that was done a few years ago. These are SAGES leaders, experienced surgeons who have used these devices for many years. We assessed their baseline knowledge, and their median score was only 59%. A third of them did not know how to correctly handle an operating room fire. 13% did not know that thermal energy can extend beyond the jaws of a bipolar instrument. 10% actually thought that a dispersive pad should be cut to fit a child. So it's not that just we don't know about it, we don't know that we don't know. So we're completely oblivious, which I think makes it very dangerous. The same target population was asked where they got most of their training on energy devices, and we can see that the majority get them from industry rep. There's nothing wrong with that. We need to learn from industry, but I think there's some limitations to that. We don't ask the industry to teach us how to do a bowel anastomosis, even though they sell us staplers. I think the same principle applies. We should be teaching ourselves about energy devices. So, bad complications and very poor understanding. This creates a scenario where surgeons have a very big knowledge gap in the safe use of energy devices. So I highlight to you that there's a very profound and strong unmet need in the surgical community for a curriculum like FUSE. And I think SAGES has really stepped up to the plate to address this need. Because let's face it, would you let yourself be operated on by a surgeon who never got any basic training on the device that he will use on you? I think most of us would say no, and I think the public would say no. Would you get on an airplane if you knew that the pilot didn't have basic training on the device he uses or he or she uses? We just got this navigation system here, but the rep showed me in the hallway, let's fly the airplane and see. I personally would not get on that airplane. So I described to you the problem. Now let's talk about the solution, FUSE. It is a basic curriculum in the science of surgical energy. There's a web-based format and a book-based format. Now it's similar to the other two fundamentals program, FLS and FES. They have these online modules. It's web-based. You go through one module at a time for the didactic portion. But unlike FLS and FES, it does not have a hands-on assessment or training component for now. It is purely didactic. It is developed by a multidisciplinary team, so it's surgeon, anesthetist, nurses, and even engineers. It has the curriculum, and it also has an assessment component to go with the program. So this is what the curriculum looks like. There are 10 domains, chapters, as well as 63 objectives. We heard Dr. Munro give us a very nice primer in the first section, the fundamentals, but it's not just about joules and ohms. It's very clinically relevant. The focus here is on safety. You can see the majority of the objectives are in the adverse events section, so it's very applicable to what you do. We talk about monopolar devices, bipolar devices, RFA, endoscopic devices, ultrasonic systems like the harmonic, microwave energy systems, pediatric considerations, and also the considerations you should take into account when you operate on a patient with things like pacemakers or implantable cardiac defibrillators. So the focus here is on safety. Oh, you can't see that. This is what the modules look like. It's very nice animations. You have a narrator, you have the content description here, and it's very user-friendly to use. I talked about an assessment component to go with it. The FUSE certification exam has undergone a very thorough, rigorous, and transparent psychometric validation process to create a high-stakes exam. Some of you have written the beta test that was sent out a year ago. And I'm happy to say that just before the SAGES started, we wrapped up sort of the last step here, and about 170 people are now FUSE certified. So expect that in the next month or two, this program will be available for everyone. So right now, FUSE is in its infancy. You may be asking yourself, okay, is it effective? Is there any evidence to show that this program is effective in terms of improving your knowledge? Well, this is a postgraduate course that was done at SAGES a few years ago. People have gone through a day-long didactic session to teach about energy devices, and their knowledge improved from 55% to a median of 90%. These are different exams. So there's not only poor baseline knowledge, but again, a formal curriculum can improve that knowledge, at least in the short term. We took this one step further, and at my institution, we designed an electrosurgical course for our residents. It's just a 1-hour didactic, that's it, 1-hour didactic based on the FUSE curriculum associated with a 1-hour hands-on session, which teach them about how to set up the device, what kind of tissue effects to expect, and also the adverse events related to electrosurgical devices in both open and laparoscopy. And the residents really enjoyed this session. We took them through the curriculum, and their median score increased from 46% to 84%. These are different exams again. We took this one step further and reassessed them 3 months later to see if there's retention of knowledge. And again, their scores are 71%, so it's better than it was at baseline. So you don't lose what you learn months later, but it's not as good as it was immediately after the curriculum. So number one, there is retention of knowledge, and also I want to highlight to you that this program can easily be interwoven into a residency training program. So we can teach trainees from an early stage some of the best practice guidelines to adopt. Now I told you what the problem was, I told you what the solution was. Now I want to leave with this. I've been very fortunate to be part of the FUSE program, and I think it's a very remarkable program. It's effective, it's highly needed in the surgical community, and take it from me, I've trained several residents in this program. I've given grand rounds a few times, and people love this. It doesn't matter if you're a first-year resident who's picked up the monopolar device for the first time, or if you're a surgeon with 50 years of experience. They all come down and say, wow, I had no idea. FUSE is here to stay. It's only a matter of time before you see this program widespread nationally and internationally. I think it's a matter of time before hospitals, administrators, accrediting bodies, the boards begin to demand that surgeons show that they have the basic competency to use energy devices before operating on patients. Thank you very much.
Thank you very much, Dr. Madani.